When it comes to Medicare, timing and understanding are everything. Yet, every year, thousands of seniors make the same costly mistakes. Mistakes that could have easily been avoided with the right guidance. If you're approaching age 65, or even if you've already enrolled in Medicare, what you're about to hear could save you thousands of dollars, months of frustration, and a lot of unnecessary stress. So stay with me till the end, because I'll explain not just the 5 most common Medicare enrollment mistakes, but also how to avoid each one with confidence and peace of mind. Imagine this for a moment. You've worked hard your whole life, paid into the system, and now it's finally time to enjoy the benefits you've earned. You expect Medicare to be simple: sign up, get coverage, and move on. But what you find instead is a maze of parts, plans, penalties, and confusing deadlines. And the truth is, Medicare can be one of the most misunderstood systems in the U.S. health landscape. Most seniors don't realize they've made a mistake until they get a surprise bill in the mail or a letter saying their enrollment window has closed. By then, it's often too late to fix easily. That's why in this video, I'm going to walk you through the 5 most common enrollment mistakes seniors make, what they really mean, and exactly how to avoid them. And if you stay with me till the end, I'll also share a simple step-by-step strategy that can help you enroll correctly and avoid penalties altogether. Let's start with the first and probably the most expensive mistake: waiting too long to sign up. Many people assume that they don't need to enroll in Medicare at 65 if they feel healthy, or if they plan to keep working. And while that can sometimes be true depending on your situation, most people don't realize that missing your initial enrollment period can lead to lifetime penalties. For Medicare Part B, the penalty increases your premium by 10% for every 12 months you delay enrollment. And that penalty stays with you for as long as you have Medicare. I've met seniors paying hundreds of extra dollars each year just because they missed their window by a few months. So how do you avoid it? Know your timeline. Your initial enrollment period starts 3 months before the month you turn 65, includes your birthday month, and ends 3 months after. That gives you a 7-month window to sign up for Part A and Part B. Even if you're working past 65, you should talk to your employer's benefits department to make sure your current insurance qualifies as creditable coverage. If it doesn't, you need to enroll in Medicare on time, or you'll face penalties later. Now, the second mistake is assuming that Medicare covers everything. Many people are shocked to discover that Original Medicare, that's Part A and Part B, doesn't cover most prescription drugs, dental care, vision exams, hearing aids, or long-term care. Seniors often think, I have Medicare now, so I'm fully covered. But when an unexpected bill for thousands of dollars shows up, reality hits hard. Medicare is great, but it's not complete. You need to think about how to fill the gaps. This is where a Part D prescription plan or a Medicare Advantage plan can help. Part D covers prescription drugs, while Medicare Advantage, or Part C, bundles your hospital, medical, and often drug coverage together, sometimes even adding dental and vision. The key is to compare your options carefully. Every plan has its own network, costs, and rules, so don't assume the plan your neighbor has is right for you. Take the time to match your needs, medications, and doctors to a plan that truly fits your life. The third mistake seniors make is not reviewing their coverage every year. Medicare isn't a one-time decision. Plans change, premiums go up, formularies shift, and doctors move in and out of networks. Yet, too many people just let their plan auto-renew without checking what's changed. Every fall from October 15th to December 7th, you have the annual enrollment period. Your chance to review, compare, and switch if needed. Ignoring that window could cost you hundreds or even thousands each year. I once spoke with a retired teacher who didn't realize her Part D drug plan had changed its formulary. A medication that cost her $10 last year suddenly cost her over $100 this year. She hadn't reviewed her plan, and by the time she noticed, the enrollment period had passed. The fix? Make it a yearly routine. When the annual enrollment period opens, take an hour to review your coverage. Check if your prescriptions are still covered affordably, and if your doctors are still in network. That small effort can save you a lot of money and frustration. Mistake number 4 is misunderstanding how employer or retiree coverage works with Medicare. Many people keep their job-based insurance or retiree benefits and assume they don't need to enroll in Medicare yet. But the coordination between those plans and Medicare can be tricky. If your employer has fewer than 20 employees, Medicare usually becomes your primary coverage once you turn 65. That means your employer plan pays second. And if you're not enrolled in Medicare, you might have no primary coverage at all for certain claims. To avoid this, talk to your benefits administrator well before turning 65. Ask whether your employer coverage counts as creditable for both Part B and Part D. If it does, you can delay enrollment safely. If it doesn't, you'll want to sign up right away to avoid penalties and coverage gaps. The fifth mistake is forgetting to sign up for Part D, the prescription drug plan. Even if you don't take any medications right now, you still need to have drug coverage that's considered creditable. If you skip Part D when you're first eligible and later decide to enroll, you'll pay a permanent penalty for every month you went without coverage. It's only a few cents per month of delay, but it adds up, and you'll pay it for the rest of your life. The smart move is to enroll in a low-cost Part D plan as soon as you're eligible. That way, you're protected in case your medication needs change later. Now, I know this all sounds like a lot of rules, dates, and penalties. Medicare can feel overwhelming, and it's not your fault. The system wasn't designed to be simple. But the good news is, once you understand these key points, you're already ahead of most people. You don't have to memorize every detail. You just need to be proactive and pay attention to your timelines. And here's something many seniors don't realize. If you made one of these mistakes in the past, there might still be a way to fix it. There are special enrollment periods for certain situations, like losing employer coverage, moving to a new state, or qualifying for financial assistance. So even if you think you've missed your chance, don't panic. There are often ways to get back on track with the right help. Before we wrap up, I want to share one more bonus mistake that many seniors make: relying on hearsay or outdated advice. Medicare rules change frequently. What worked for someone else 5 years ago might not work for you today. Always verify your information through trusted sources or with a licensed Medicare expert. And if you ever feel confused or unsure about your options, don't hesitate to get professional guidance. Now, if you found this information helpful, make sure you subscribe to Medicare Mentor. On this channel, we simplify Medicare so you can make confident, informed decisions about your healthcare and your wallet. Every week, we break down new changes, cost-saving tips, and practical strategies to help you get the most from your coverage without overpaying. So, take a moment now. Click that subscribe button and turn on notifications. That way, you'll never miss an update that could save you money or prevent a costly mistake. Let's quickly recap what we covered today. First, don't wait too long to enroll. Timing is everything. Second, remember that Medicare doesn't cover everything, so consider your supplemental options. Third, review your coverage annually because plans change. Fourth, understand how your employer or retiree coverage coordinates with Medicare. And fifth, don't skip Part D, even if you're not taking medications now. If you follow these steps, you'll be setting yourself up for a smooth and affordable Medicare experience. Avoiding these common mistakes can literally save you thousands of dollars and hours of stress. Remember, Medicare isn't about guessing, it's about planning ahead. You've earned your benefits, you've worked for them. Now it's time to make sure you get the most out of them. And if you'd like more guidance on topics like Medicare Advantage, Part D savings, or how to avoid out-of-pocket surprises, keep watching here on Medicare Mentor, where we turn confusion into clarity and help you make Medicare simple. Thank you for spending this time with me today. I'm Dr. Thomas with Medicare Mentor, and I'll see you in the next video. Stay healthy, stay informed, and take care of yourself, because when it comes to Medicare, knowledge truly is your best medicine.